Artificial intelligence is revolutionizing healthcare. It's accelerating diagnoses, optimizing treatment plans, and promising a future of personalized medicine. However, beneath the promise, there's a troubling reality. AI systems can perpetrate and amplify existing biases, hallucinate for certain diagnoses, and even be inconsistent in what it recommends, ultimately making healthcare worse. So before I begin, my name is Theo Harvey, and I am a healthcare technology entrepreneur. I have worked with large organizations like Google, Blue Cross Blue Shield, and nonprofits like Charles Barkley Foundation. The goal of this channel is to explain the rapidly changing healthcare field for healthcare professionals so it can be simple and to understand and what's going on. My promise is to keep coming up with great content to help you navigate this new normal. So when we talk about healthcare challenges, we know what's happening right now, right? We understand that artificial intelligence tools such as algorithms are advancing rapidly, right? Every day, almost every other day, you're seeing new innovations being pushed out into the field. Google just announced new models that be able to create video with sound. We saw that Chinese manufacturers with new technologies, DeepSeek, is creating innovations that is fastly advancing, even cheaper than things like OpenAI, ChatGPT, or Anthropic. So there is so many different things just coming so much that they call it AI slop. It's just so much content. So how do you navigate all this, right? In some ways, like we talked about, AI is here to stay and it's helping, right? And there are some tools that are really helping patient care. One of the things that we're seeing, more and more is that it's evolving with doing better diagnostic accuracy, right? Predicting patient outcomes using artificial intelligent algorithms to do predictive analysis on how likely a patient is to go into the hospital is becoming very helpful. And also doing things like streamlining administrative tasks, right? So think about it. If you are a busy professional, what if you had what they call an AI scribe? This is an ambient listening tool that is listening and be able to summarize everything you're talking to the patient so that you don't have to write this down. And more importantly, it's taking this information and making it so it can be billable. This is huge for a lot of practices, right? As they're looking to expand into this space. The goal here is to make sure you understand exactly what you're trying to deliver at a scale. And this is just exploding. The global AI healthcare market is projected to grow from 26 billion in 2024 to around 613 billion in 2034. This represents a growth rate of around 36% compounded annually. This is huge. And more importantly, practitioners deliver better care. Think about healthcare. It can be unruly. There's a lot of regulations. There's a lot of workflows. AI is perfectly suited to optimize those workflows to ensure that you get the best patient care for your patients. And really, the other thing, unique thing about AI is the way it can personalize healthcare plans, right? So think about this. You have a patient that is an elderly patient, but they may be able to move a little bit more than certain other patients. And so they have dietary needs that require more food intake, more protein intake. So you may need to maneuver their care a little bit differently than another patient who may not be as active, right? And doesn't need as much protein in helping them. So there are different ways to think about how you can deliver care, and healthcare can be very personalized, and this can be difficult sometimes to keep track of that. But with artificial intelligence, you can do that, right? Because it can absorb so much data at a time and create multiple recommendations based on historical patterns. Let's think about AI right now is what we call large language models. It has basically absorbed a bunch of data from different data sets across the internet and able to make better recommendations for patients. So this is something that is good. I'm going to use a lot of Star Wars analogies here, but it's very similar to Obi-Wan Kenobi, right? He is on the good side of the force, right? AI is absolutely a good force in order to help personalize medicine and to make it more realistic for patients who are struggling, and that's super important. There's an example, a case study with these AI scribes. Mass General Brigham conducted a successful pilot program with different ambient listening programs with over 2,500 physicians. And using technology, they will include around 90% of them were primary care providers. So they're the ones who are on the front line talking to patients on a consistent basis. In the pilot, physicians reported cutting daily documentation time outside clinic hours to under 30 minutes when it originally was 90 minutes. And they were able to help. Around 79% of them said they were able to focus more on the patients, and 60% of those primary care physicians indicated they were more likely to extend their careers because they didn't suffer from burnout. Burnout is doing tasks that you just don't like doing, that's a drag, and that can really overwhelm you. And so now with the physician spending more time with the patient because the listening devices are taking that information, that is saving physicians time and effort. My wife, who is a nurse, she briefly worked with an AI company that was training their model to communicate with patients to get better information from them. Kind of like a triage, so that they can talk to the patient, collect as much information as you want, not unlike a front desk person at a medical practice, right? Who's gathering insurance information, gathering, some simple diagnoses before the real professional can come in. And so helping train that model to be more efficient was super important for her. And so, and really help guide the AI company toward that. So absolutely, totally positive, when we look at this. But unfortunately, there can be a dark side, right? Using my analogy again, right? We're looking at the dark side of AI on this video. And in 2019, a study revealed that widely used healthcare algorithm, which was affecting over 200 million people in the United States, exhibited significant racial bias. The algorithm used healthcare costs as a proxy for health needs when it inadvertently disadvantaged Black patients from getting the care that they need to receive. Yeah, so for example, this is a case that happened. So basically, Black patients typically incur about $1,800 less in medical costs per year than their white counterparts with similar health conditions. And what they found is, as a result, the algorithm underestimate the health needs of Black patients, leading to fewer referrals for advanced care. Only 17.7% patients that the algorithm assigned to receive extra care were Black, whereas the actual population should have been closer to about 46%. And so that is a case where there can be biases when you're kind of looking at the data. And that is definitely not on the good side of how this force for good, this technology, could disadvantage people disproportionately, right? And so that's something that you really want to consider. There's a term, I don't know if you've heard it, but bad data in, bad data out. And basically, if you don't have great data, obviously it doesn't arise from malice, but from the data that is fed. Historical inequalities, underrepresentation in data sets, flawed proxies can all contribute to just biased outcomes, right? And that's not unlike a human being who has certain biases, whether it's due to where they were raised. Let's say, for instance, you were raised in colder weather. You may not know what hot really is until you may not have all the clothes because you were biased toward living in an environment that was a little bit colder, right? And so this is very similar to how the algorithms are fed. They have information that may be one way or the other, right? I mean, there have been cases where AI has been accused of leaning one direction or the other politically, right? Based on what it was fed. And so that's something that can be absolutely be the case, right? You can definitely, whoever develops the algorithms can put their thumb on how they're created and create a whole list of biases. For example, the medical testing rates for white patients are up to 4.5% higher than for Black patients. So they weren't getting the same testing that they needed in order to kind of help with the patient populations. I also saw electronic health records often contain stigmatizing language, which can influence AI predictions and perpetuate disparities. So if the language is not proper or communicate more effectively, that can affect how AI is being delivered to patients, and patients not accepting that, right? And it's so important for that as you kind of think through that. The other concern, beyond biases, is just the nature of AI in itself. It can lie. In other words, it can hallucinate, which is definitely something that healthcare does not need. We all went through the pandemic and COVID. There were a lot of influencers out there who were giving their opinions. These were not evidence-backed studies. This wasn't based in data. This wasn't peer-reviewed journals. This was based on anecdotal knowledge. This was based on having a brand deal. And so a lot of misinformation went out there during COVID time around healthcare. And, it just proliferates, right? And so when you kind of think about it, hallucination is also around AI. The goal is for it to create information, and because it's so quick and fast, it may seem more truthful, but it's not, because the data is being fed is probably not accurate. But its intention is to give you the most information to help you out. So it may embellish things, and it can find that embellishment by creating words, strings of words together that just make sense from what it read before from the internet. And so that can be very dangerous, especially in healthcare, right? So for instance, going back to the AI scribes, right? Those tools that can listen in and kind of create a better environment so doctors don't have to consistently write their notes down. They can just speak it out. One study of a pilot for around 10,000 patients at a Permanente medical group in California published last year found that while feedback from patients and doctors was extremely positive, AI scribes did produce inconsistencies and required a physician's review and editing, highlighting that AI is not a replacement for a doctor. That's correct. It helped in a lot of cases, but there still needs to be a human interface there in order to ensure that the information was not inaccurate, because too much inaccuracies, as we can know, can lead to adverse outcomes, basically patients inflicting harm. And obviously the Hippocratic Oath, the first thing the doctor is supposed to do is to do no harm. And so you want to make sure that these algorithms are not doing any harm because of their hallucinations. And that's so key. There is, a path forward, right? If we go back to the good side, right, there is a path forward to eventually defeat the dark side. If you remember in the classic Star Wars movies, these two fought, right? The original and best sequel, in my opinion. So they two fought, right? And so the dark side may have won initially, right? But then the light side had something underneath. So there is a light going forward. So recognizing the problem is always the first step, and researchers and institutions are now, working to rectify these biases, right? I think one of the things they're looking at is just adjusting algorithms to predict health needs a little bit more easier. Not just looking at costs, right? But looking at other things like this in care recommendations so that we can significantly reduce those disparities that come in there, especially for Black and brown populations. You also want to incorporate, diverse data sets and continuous monitoring, like remote patient monitoring, blood pressure monitoring, data that's coming lively from the patient while they're at home doing their care delivery can enhance existing data sets. You may have claims data, but the claims data is not giving a full picture, but only if you can have information that's coming from the patient live, and that can come from reading their diabetes readings, their blood pressure readings, anything that can incorporate that. Even something as simple as getting their state of mind on a daily basis with a journal or something to that effect is something that can be extremely powerful for patients to help make better decisions and providing better data back to the clinicians to make better decisions on the care for that patient. So this is something that more and more folks are looking at. I think experts have definitely identified these bias in these algorithms, and they're considering ways to kind of make them less biased. And also looking at the algorithms they use, the core models that were built by private institutions like OpenAI, Anthropic, you want to kind of be wary of those, right? Because you don't know how they're trained or what they're giving weight to. But there are other ones like Hugging Face is an open AI algorithm that you can look at. Facebook is developing one, Lambda, that you can go in and understand how it's being developed. And I did a video on that, so go check that out, on all the different models and how they all work. If that's something you're interested in, to get a little deeper dive understanding of these AI tools and what they can mean for the future. So I think, when you kind of look at the broader indications, the future is bright when it comes to these tools. I just think that we can kind of harness AI's potential, but we have to safeguard against its pitfalls so that we can take proactive steps in that direction. So some recommendation is definitely you want to implement transparency in AI decision-making processes. Right now, we have, as I'm recording this video, we have a policy in the U.S. government. There are no guardrails right now, right? We're trying to just develop and push back against other foreign countries taking lead in AI. But I do feel like, having more transparency in how this develops so people can follow the math, if you will, is going to be extremely important as these tools become super powerful. You want to engage different and unique stakeholders and voices in this AI development, right? Getting people to talk about how this is being used, and more importantly, where you can use it at, right? You don't want to be the one not in the room, making sure that your voice is being heard when these algorithms are being created, but also being used, implementing, and not replacing massive amount of jobs for no reason, right? And finally, you want to establish a framework, a regulatory framework, just so that we can monitor and address any biases or any hallucinations that come up. All it takes is one natural big disaster that could come about that can do extreme harm. And so before that happens, the stakeholders probably should get in the room together and start putting together some bases to kind of prevent that from happening. So those are some of the things to look at. And yes, it's policy, and that can come from government, but it can also be driven on the ground up with individuals who are on the ground level taking hold of it. I will say this also, at the ground level, it's imperative that you understand these tools intimately. Start playing with them in your medical practice, in the way you deliver care. Not talking about creating care plans to ChatGPT, but thinking of ways to kind of use it to make your job easier. Yes, scribes are one thing, but can you help create patients' diet plan, walk them through that process? Can you use it to put together a scheduling so it's easier for you to speak to your patients? Can you create a personalized messaging with it? Those are some ways that you can utilize it. And look, if you want some more insight on how AI can help your medical practice or how you continue to grow, definitely there's some links below that we talk more about how some of the things that we're doing with our medical practices to help them not only generate more revenue, but ultimately provide better care for their patients for the future. So those are some things that you can look at below. But ultimately, artificial intelligence holds immense promise for transforming healthcare, enhancing diagnostic accuracy, and personalized treatment plans, and really ultimately improving patient outcomes, which is the goal for all healthcare. But without vigilant oversight, AI can lie and provide unequal care as that dark side starts to creep up again against folks. So you want to make sure the path forward, we want to have intentionality and exclusivity and a commitment to not just equity, but truth finding. And that's just acknowledging that there can be potential biases in AI systems, that the AI systems have a tendency to hallucinate, and making sure you put structures in place to mitigate against that. And one of those structures is having diverse stakeholders from developers, clinicians, policymakers, and patients to collaborate to ensure these AI technologies are at their best to provide the best care for patients and not harmful care. So ultimately, it's up for us to change the future as healthcare is changing rapidly and the technology is succeeding that more and more as we see for the future. So hope you enjoyed this video. I have more videos where I talk about AI, so go check them out. If you have any questions, continue to listen to our next video where we talk more about how healthcare is evolving in this new normal.